The National Partnership for Women and Families is a nonprofit, nonpartisan advocacy group that has been working on issues important to women and families for almost 4 decades. I thank you for inviting me to testify in support of this legislation that workers urgently need during this national H1N1 emergency. And Mr. Chairman, a special thank you to you for all you've done to shine a spotlight on this issue. The National Partnership leads a very broad-based coalition in support of paid sick days. I'm testifying today on behalf of the millions of people represented by civil rights, women's, children's, anti-poverty, disability, labor, health, and faith-based communities. We all urge you to move quickly to pass legislation that guarantees working people paid, job-protected time off from work to recover from their own illness or to care for a sick child or family member, especially during this H1N1 epidemic. It's a travesty that millions of hard-working people in this country have no paid sick days. Almost half of private sector workers and 4 in 5 low-wage workers, most of them women, don't have a single paid sick day. And especially now, when H1N1 has infected millions, our failure to provide a minimum standard of paid sick days is taking a terrible toll. Over the past few months, experts and public officials from the CDC to the President have been telling us to stay home and keep sick children home to prevent the spread of the virus. That's great advice, but unfortunately, millions of workers simply cannot take that advice. For them, staying home means risking their paychecks and even their jobs. So what's responsible? What's doing the right thing when staying home means risking the paycheck that your family depends on? People who provide care for family members face even greater challenges. We know that the H1N1 virus attack rate among children and youth is especially high. Many of them need a parent to care for them when they get sick. And that's why the lack of paid sick days is particularly challenging for working women who have primary responsibility for child care as well as elder care. Our failure to guarantee paid sick days also is particularly hard on low-income people and those in communities of color who tend to hold low-wage, no-benefit jobs. The Boston Public Health Commission recently reported that the incidence of H1N1 is much higher for African Americans and Latinos in that city. Without paid sick days and the ability to stay home or get care, the disease spreads more rapidly and people get sicker. The lack of paid sick days is also putting our public health at risk. Only 22% of food service and public accommodation workers have paid sick days. Workers in child care centers and nursing homes disproportionately lack paid sick days. They're forced to work when they're sick, and in so doing, they put their coworkers, those they care for, and the public at risk. And while the need for paid sick days is particularly compelling during this H1N1 emergency, the reality is that working families struggled without paid sick days prior to this emergency, and they will continue to struggle unless and until Congress acts. Every year, the seasonal flu and other illnesses strike millions of us, and every year, our failure to let workers earn paid sick days puts the economic security of families at risk. And the recession we're in exacerbates the problem. I certainly don't need to tell you how many families that once relied on 2 incomes are now managing on 1 or none. In a survey last month, 5 out of 6 workers said the recession was creating more pressure to show up for work even when they're sick. Mr. Chairman and members of the committee, we need a minimum standard of paid sick days so that taking time off for the flu or any other illness does not lead to financial disaster. Finally, I'd like to end with the point that paid sick days are also good for business and our economy. Today, Stanford University Press is releasing a book called Raising the Global Floor, a book by Jody Hyman that reports on an 8-year study examining the impact of paid sick days, paid family leave, breastfeeding, and other family-friendly policies around the world. It concludes that nations that guarantee leave to care for personal or family health needs are actually ranked highest in terms of economic competitiveness. And I'd be happy to provide copies of that book for every member of this committee. The research confirms that when businesses take care of their workers, they're better able to retain them, and when workers have paid time off, their commitment, their productivity, and their morale increases. Employers reap the benefit of lower turnover and training costs. The cost of losing an employee is often much greater than the cost of providing short-term leave to retain an employee. And in this economy and during this health emergency, smart businesses know that they can't afford presenteeism, workers who go to work sick and get other people sick and cause more absenteeism. Presenteeism costs our national economy $180 billion annually, more than absenteeism. So like the minimum wage, our nation needs a basic federal labor standard of paid sick days that protects all employees, is paid, is job protected, is accessible to workers at their discretion, and is available to care for a sick child or parent. I urge you to pass the Healthy Families Act quickly, and I thank you for this opportunity to testify.